What if I told you that you could reduce your double chin, define your jawline, breathe better, align your teeth, reduce sleep apnea, all by doing a simple exercise at home for free? Would you believe me? If you've spent a considerable amount of time on YouTube, you've probably heard about a trend among YouTubers who claim to have changed the shape of their face using something called mewing. Mewing is an exercise in which you must strategically place and press your tongue against the roof of your mouth. This is done for prolonged periods, as well as during deglutition, that is, when you swallow. This technique supposedly helps your breathing become more nasal, helps reduce the double chin, helps reduce pain in the chewing muscles and the mouth, and aligns the upper teeth with the lower ones. And it also helps to modify facial features, leaving a more defined and more aesthetic jawline. All of this is achieved by repeating this exercise over a long period of time. Now, there are different types of people interested in these exercises. The first group includes people concerned about their physical appearance, who practice this technique to develop a much more square, more aesthetic jawline, to give them more volume in the angle of the jaw area, and also to reduce their double chin. Another group is made up of people who are concerned about being mouth breathers. People who breathe through their mouth and not their nose face several long-term consequences. For example, inflammation and bleeding of the gums, incomplete facial development, a greater propensity for respiratory tract diseases, malocclusions, meaning an incorrect bite, especially due to a lack of development of the palate, and many other implications. This technique proposes that mouth breathers further develop their nasal cavities so they can breathe through their nose and not their mouth, and therefore decrease the risk of having the problems we've already mentioned. Achieving all this with a simple exercise done at home at no cost sounds great, doesn't it? But it has reached such an extreme that there are even YouTubers who offer consultations via Skype to help you learn how to do mewing. Now, how did we get to the point where YouTubers who aren't even dentists are giving orthodontic advice? This is all due to Dr. Mike Mew, a British orthodontist who introduced this technique to the YouTube platform. And it's also where the users themselves gave it the name mewing. But look, this technique isn't new. It's been around for many years, and many people have studied it. However, it recently became famous because of this doctor. And now several famous YouTubers have adopted it to generate more likes and more views, posting before and after photos of how mewing helped them develop that jawline. However, it's very doubtful whether those photos were actually taken correctly, from the right angle, or if they weren't modified with Photoshop. You know that with Photoshop nowadays, in 10 minutes you can completely modify a person's facial structure. And as long as we don't have the before and after completely recorded on video and without any kind of modification, we won't know if what they're saying is true or if they're just looking for more fame. Now, the mewing technique is interesting. It sounds logical, but what they don't tell you is that it takes many years of doing it to actually see a noticeable change. Especially for those patients who already have their muscles and bones developed, patients over 18 years old who are already fully grown. So if you do this looking for facial changes, and especially in the short term, you're gonna get very frustrated. When you see that for many days, you don't notice any change at all. And what could happen to you, and much more quickly, is that you start to have adverse or unwanted effects from doing this technique incorrectly. Look, placing your entire tongue on the roof of your mouth sounds very easy, but it's not. Many people, when trying to do this technique, unconsciously place their tongue too close to their upper teeth and apply pressure, which causes the upper teeth to be pushed forward, and obviously they all move, negatively affecting the aesthetics and the bite. Another problem that could easily happen to you is hypertrophy of the supra and infrahyoid muscles, which are muscles we have in our neck that are responsible for example, opening the mouth and specific movements of the tongue. And when they hypertrophy, this could cause very intense pain under your tongue and make eating and swallowing extremely uncomfortable. I've even had comments on my channel from people who have tried this technique and are experiencing just that. Very intense pain under their tongue that prevents them from swallowing their food. Another risk of doing this technique incorrectly is overstimulating the muscles of mastication, causing involuntary teeth clenching, especially at night, and this will cause you to destroy your teeth. So since I can't carefully review the technique of each patient or subscriber, it's very likely that some will do it wrong and cause these kinds of problems for themselves. On top of that, no matter how much mewing you do, if your teeth are in the wrong position or if your maxilla or mandible are different sizes, it's going to be very difficult for them to be fixed with this technique alone. And most likely, doing this exercise won't help you at all to correct your bite. It might even make it worse. Now, what is it that I do like about this technique? Doing mewing at an age of facial development, specifically adolescents who are undergoing their craniofacial development, sounds very promising and could help young people develop much better. Also, reducing the possibility of them becoming mouth breathers or having dental crowding, that is, crooked teeth. Or even, let's go a little further, a lack of mandibular or maxillary development. There are two problems here. The first is that the adolescent does it correctly. And the second is that it's very difficult to define who can improve just by doing this exercise and who will also need orthodontic help and orthopedic appliances. Now, another thing I also really like about this is that it encourages people to be more aware when they chew. This means that people have to chew each food conscientiously, and they have to be aware of their tongue's position at all times, especially when swallowing. This is because many people, when swallowing their food, put their tongue between their teeth. In fact, I bet you're trying it at home right now. Swallow. If you swallow and you don't put your tongue on the roof of your mouth and instead you're putting it between your teeth, you have a problem and you're probably creating an open bite. Therefore, you'll need to go get checked by an orthodontist. Finally, what I also like about this technique is that it makes people more aware of nasal breathing, which is vital for human beings in their facial development and obviously for their oxygenation as well. So in conclusion, if you've already passed the development and growth stage, it's very likely that even if you try it every day, you won't see any changes. And perhaps doing this technique every day might cause you problems. So I suggest that before you start doing these exercises at home, you first go see an orthodontist. Especially if you think you have any of the problems I mentioned earlier, or if you simply want to change your facial structure. Now, if your issue is purely aesthetic and you want to change the shape or structure of your jaw, or your chin, there are different and minimally invasive techniques to improve this, such as the injection of calcium hydroxyapatite and other substances. But that's not my specialty, and I'd rather not recommend or talk about topics that I haven't mastered. Lastly, remember that do-it-yourself methods are very prone to scams because they're very attractive. So I recommend that you always be very careful about the source giving you that advice. And preferably always visit a specialist in the field to get an opinion. That is 100% medical. Don't put your health at risk. So if you really like these videos, subscribe to my channel. It's free information that can greatly benefit your health. Like and share it so more people can learn about mewing, its benefits, and the risks it has. I'll see you on Instagram at Dr. Federica Baina Kwok, and I'll see you in the next video. Take care.